Have you ever felt like you're stuck in a loop, replaying the same negative thoughts over and over again? For millions of people struggling with depression, this isn't just a bad day. It's a constant reality. Traditional treatments like antidepressants and therapy work for many, but for a significant number of people, they just don't provide the relief they desperately need. A path that could potentially reset the brain and offer a new perspective. Today, we're diving deep into the world of psychedelic therapy, specifically focusing on psilocybin, the active compound in magic mushrooms, and its groundbreaking potential for treating depression. Now, when you hear the word psychedelics, your mind might jump to a very specific cultural image. But what we're talking about here is worlds away from recreational use. This is about controlled, clinical, and therapeutic application, guided by professionals in a safe setting. So, what exactly is psilocybin, and how could it possibly help with something as complex as depression? Psilocybin is a naturally occurring psychedelic compound found in certain species of mushrooms. For thousands of years, indigenous cultures have used these mushrooms for spiritual and ceremonial purposes. But in recent decades, science has started to catch up, and the findings are nothing short of remarkable. Researchers at top institutions like Johns Hopkins and Imperial College London are conducting rigorous clinical trials, and the results are consistently showing that psilocybin, when used in a therapeutic context, can produce rapid and sustained antidepressant effects. To understand how this works, we need to talk about the brain. In a depressed brain, certain patterns of activity become rigid and entrenched. Think of it like a ski slope, where you keep going down the same well-worn tracks, over and over. These tracks are negative thought loops and rigid ways of thinking about yourself and the world. One key brain network involved in this is the default mode network, or DMN. The DMN is most active when our minds are wandering or thinking about ourselves. In depression, this network can become overactive, keeping people locked in cycles of rumination and self. This is where psilocybin comes in. It acts primarily on the brain's serotonin receptors, the same system targeted by many common antidepressants, but it does so in a profoundly different way. It's like shaking up a snow globe. The old, rigid patterns are broken, and the brain enters a state of heightened flexibility and connectivity. This is often described as a neuroplastic state, where the brain is more open to change and learning new pathways. It's like fresh snow has fallen on the ski slope, and suddenly, you can create new tracks and go in entirely new directions. This neurological reset is accompanied by a powerful psychological experience. During a guided psilocybin session, individuals often report profound insights into their lives, their relationships, and the root causes of their suffering. They may revisit difficult memories, but from a new, more detached and compassionate perspective. Many describe a feeling of deep interconnectedness, a sense of unity with the world, and a dissolution of the ego or the sense of a separate self. These mystical type experiences, as researchers call them, are strongly correlated with positive therapeutic outcomes. The more profound the experience, the greater the reduction in depression symptoms. It is crucial to understand that this is not a take a pill and you re-cured the situation. The therapy part of psychedelic-assisted therapy is just as important as the psychedelic itself. A typical treatment protocol involves extensive preparation sessions with trained therapists. This is where you build trust, set intentions for the experience, and learn what to expect. Then comes the dosing session itself, which takes place in a comfortable, safe, and controlled environment, often with music and shades, to facilitate an inward journey. Throughout the entire experience, which can last for several hours, 1 or 2 therapists are present to provide support and reassurance. But the work doesn't end when the drug wears off. In fact, some of the most important work happens afterward in what are called integration sessions. This is the period where you and your therapist work to make sense of the experience. You discuss the insights, emotions, and visions that came up during the session and figure out how to translate them into lasting changes in your life. The psilocybin opens the door, but it's the integration work that helps you walk through it and stay on the other side. This is about taking those new tracks you saw on the ski slope and making them your new default path. The results from clinical trials have been incredibly promising. Studies have shown that even a single dose of psilocybin, combined with therapy, can lead to significant and lasting reductions in depression symptoms for a majority of participants. Some studies have found that these effects can last for months or even over a year after just 1 or 2 sessions. This is a radical departure from traditional antidepressants, which often need to be taken daily for years and can come with a host of side effects. Of course, this therapy isn't for everyone, and it's not without risks. People with a personal or family history of psychosis, like schizophrenia, are generally excluded from trials because of the potential for psychedelics to trigger psychotic episodes. The experience itself can also be incredibly challenging. It's not always a blissful journey. It can bring up difficult emotions and confront you with uncomfortable truths. That's why the presence of a trained therapist in a safe setting is absolutely non-negotiable. This is not something to be tried on your own. So, what does the future hold? Right now, psilocybin is still classified as a Schedule I drug in many parts of the world, which means it's considered to have no accepted medical use and a high potential for abuse. This has made research incredibly difficult, but the tide is turning. With mounting evidence of its safety and efficacy, regulatory bodies are starting to take notice. Some places have already decriminalized it, and others are creating legal frameworks for its therapeutic use. We are likely on the cusp of a paradigm shift in how we understand and treat mental illness. It's an incredibly exciting time. We're moving away from a model of simply managing symptoms and toward a model that aims for genuine healing and transformation. Psilocybin therapy offers a glimpse into a future where we can help people not just feel less bad, but actually feel more connected, more whole, and more alive. It reminds us that sometimes, to find a new path forward, we first need to profoundly change our perspective. The human mind is an incredible landscape, and we are only just beginning to map its potential for healing. Thank you so much for joining me on this deep dive. If you found this topic as fascinating as I do, please hit that like button and subscribe for more content exploring the frontiers of science and mental health. Let me know your thoughts in the comments below. Until next time, stay curious.